Hello and welcome to Mommy Dentist and Business Podcast. I'm your host, Dr. Grace Yum, and I want to thank all my listeners for joining us for 8 years and for always leaving us positive reviews and many accolades in the podcasting world. I am so eager for this episode, and I'm very excited to introduce our guest speaker, Dr. David Keith, corresponding member of the faculty, formerly professor of oral and maxillofacial surgery at Harvard School of Dental Medicine, and visiting oral and maxillofacial surgeon at Massachusetts General Hospital. Welcome to the show.
Thank you for having me.
Well, I would love our listeners, and I don't know, Doctor, if you are aware, we are downloaded in over 44 countries, and we have a huge listenership, and I would love for them to get to know you. If you don't mind telling our listeners something about yourself and what you do.
Well, I'm an oral and maxillofacial surgeon. I've retired now from clinical practice, and my interest started when I was training in London in the United Kingdom. And my interest in facial pain and temporomandibular disorders is really by default. No one in my department wanted to see these patients way back then. And so they gave me a clinic on Friday afternoon to see patients, and I really enjoyed it. Then I came to work at the Massachusetts General Hospital, where I was fortunate to have the chief of surgery there, Dr. Walter Goralnik, with a great interest in facial pain and temporomandibular disorders. And we've really expanded the program. We have a training program. We have a NIH grant, and we're doing a lot of interesting things over the years.
That is wonderful. I bet you have a lot of interesting clinical cases and a lot of experience with patients in pain. Why is pain management so important in dentistry?
Well, dentistry, as dentists, we know how to treat pain. This is what we learn in dental school. We're experts in local anesthesia and in relieving pain from pathology in the teeth and jaws. And so many patients come to us in pain, and we have to recognize that we create pain, but we know how to deal with that. We know how to mitigate the pain of our dental interventions, and by and large, we know how to treat pain from those surgical procedures in the postoperative period.
How do acute and chronic pain differ?
Well, I think that's a very good question. The vast majority of patients that we see in dentistry have acute pain. And as I just indicated, we are taught in dental school how to deal with it. Dental pain is common around the world. It is localized to the pathology in the teeth and the jaws. We have good ways of making the diagnosis with examination, x-rays, sometimes more sophisticated means, but by and large, those are the ones that we use most frequently. We have excellent protocols to dealing with acute pain. And when we deal with it using those protocols, the acute pain goes away reliably and stays away. May linger for a few days as a result of an intervention, but by and large, it goes away very quickly. And that's what dentists do for the majority of their time. Now, chronic pain is an entirely different circumstance, and dentists, I don't think, are very well trained, to be very honest, in dental schools to deal with chronic pain. And to define it, chronic pain is any pain that lingers or persists after 3 months. Some people would say 6, but 3 is probably the time when you should be thinking about the transition from acute to chronic pain. We don't have good ways of making the diagnosis in chronic pain. We have protocols, but they're not always very successful.
Mm.
And by and large, dentists and patients are rather frustrated by this lack of efficacy in the world of chronic pain. And the reason for that is that chronic pain, after 3 months, is mediated through the central nervous system.
Yes.
It's not a local dental or jaw problem. It's a central nervous sensitization. And that's something that we don't, we're not taught about very much, and we're not very good at treating.
Correct. It sounds a bit tricky, and the patients must feel very frustrated, and they probably have a sequela of other emotions.